When a person with a tracheostomy tube gets sick with a respiratory infection, it is important to seek medical attention. It is vital to discern if the infection is due to a virus, fungus, or bacteria. Sputum can be the key to unlocking this important information. Sputum is the name for mucus which is made by the lungs. It is also sometimes called phlegm. When a person with a tracheostomy tube has a change in his sputum, such as an increase in the amount of sputum produced and/or a change in the sputum's color and consistency, this very likely indicates the person may have a respiratory infection. To differentiate if the infection is fungal, viral, or bacterial in origin, the color and consistency of the sputum must be examined. For viral infections, the sputum usually remains clear or a pale yellow. For bacterial and fungal infections, the sputum is usually very thick and has a distinct color, such as yellow, green, red, brown, or blue. If a medical provider suspects a person with a tracheostomy tube has a bacterial or fungal infection, please ask for the sputum to be cultured. A sputum culture is a medical test which examines a person's sputum. Sputum is collected from the person's tracheostomy tube and examined under the microscope. It is then cultured for the presence of bacteria or fungus. If a bacteria or fungus is present, antibiotics can be tested against the microorganism. A report is created which tells the doctor which antibiotics will be effective at curing the infection. Sputum cultures are essential for people with tracheostomy tubes because people with tracheostomy tubes are immunocompromised. They can acquire uncommon infections which may require special antibiotics. Without getting a sputum culture, a medical provider may give an antibiotic which only works for common respiratory infections. This can be very dangerous because the identity of the microorganism is never tested for. The patient may be sent home on the wrong antibiotics. Quickly, the infection may become very complicated or resistant to antibiotics. The person may have to go to the emergency department and spend time in the hospital. Pseudomonas is a very common infection for people with tracheostomy tubes. This infection can only be treated with intravenous medicine, and in certain parts of the world, there is also a very toxic oral medicine which can be administered. The traditional medicines doctors prescribe for respiratory infections will not be effective against Pseudomonas. Getting a sputum culture is essential in treating this infection. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!